Okay, so welcome to the next section, which is about providing individualized and inclusive support for your learners. So let's quickly look at the outline. We will talk about inclusion, tiers of support, components of the IEP, and then we'll go into some information on accommodations and modifications. Okay, so we did mention this already, which is what the KHDA says from the documents. So just to reiterate that the KHDA recommends that all students have a right to education in a common learning environment, partaking in the curricular and extracurricular activities, and prioritizing those in-class interventions. So that's something important to be keeping in mind at all times as an LSA, that the KHDA and the majority of schools here in Dubai do prioritize in-class interventions. So let's look at the inclusion tiers of support. So it's broken down typically into 3 key levels. So tier 1 is where differentiated teaching takes place in the classroom. It's universal access for all. So you may hear this described as universal design. And this is where the teacher will prepare lesson plans which target different levels of learners within the classroom. So if the learner is in tier 1, this typically means that they access the general curriculum with the mainstream class. Now, tier 2 is providing additional and specific interventions. So this is for students who are starting to fall behind or are already falling behind. And it may include an IEP or it may not. So that's something to keep in mind. We also then have level 3. So this level involves individualized, intensive, specialized provision. Typically learners in level 3 will have an LSA and they will have an IEP. So understanding these tiers is crucial because it's going to affect how your learner is accessing the curriculum. So tier 2 and tier 3 is typically where you'd be working as an ILSA or as an LSA. Now in some schools, bear in mind in some schools, such as in the British system, so British curriculum schools, these tiers are actually known as levels and they have very similar descriptions, but they're referred to as levels. And something to note is that within the levels, they might have level 2A or level 2B, so that's something to watch out for. Now, do you know if your school is an RTI or an MTSS? So what does that mean? RTI stands for Response to Intervention. So this is about early identification and support for students who are facing academic challenges. So typically what this does is we have the same tier 1, 2, and 3, which are similar to what we just described, but we have progress monitored frequently to inform instruction and intervention, and it may be used to identify students with diagnoses or deficits based on how they respond to the intervention. The next one is called multi-tiered systems of support. So it's a broader framework. It integrates both the academic and behavioral support systems. So the same tiered structure as RTI, but it also extends to social, emotional, and behavioral. And for the purposes of this training, we are treating every school as if it's an MTSS so that we can include training for social, emotional, and behavioral as well. MTSS is typically a more holistic school-wide approach, and it does include RTI as a component, but then it aligns with the frameworks of PBIS, positive behavioral interventions and supports, and again, as mentioned, that's social emotional. So why is it important for you as an LSA to know if your school is an RTI or MTSS model? This is going to directly impact how you support your learner. So each model has distinct tiers of support. You make sure that you align with it. you want to make sure that you're aligning your strategies, your teaching strategies, with the school-wide practices. So you also are going to want to know how they're collecting data, how is progress monitoring, what's the purpose of progress monitoring, and really making sure that you are targeting the academic support, but also the behavioral and social emotional. And that's whether or not those goals actually are on the IEP. This is something that you'd want to be aware of. And if we think about when we talked about what kind of questions you want to ask in your interview, this would be a really nice question to ask. If you're interviewing with a school, it would be really nice to ask in the interview, are you an RTI school or are you an MTSS school? And how would that impact the work that I do with my learners? So that would be a really nice thing to make sure that you are aware of. So let's delve into the IEP. It stands for Individualized Education Program. It's to support the learning needs of the student, outline the required support and strategies. It will include goals for the academic year, and typically it's developed by the school team, the inclusion team, the class teacher, parents may be involved, and if possible, the student should be involved. If they are able to do that, it's recommended that they get involved. So the key components of an IEP. Now, just to note that IEPs come in all different shapes and sizes. Not all IEPs will contain each of these key components. They may have some of them, they may have something different, but we're going to outline the general recommended components of an IEP. Personal information, this is a made up example of a student, so this might be the kind of thing that you see as the personal information for the student. We then have our tier and KHDA classification. So the reason that you need to know your learner's tier is, as mentioned, are they tier 2 or are they tier 3? Because that's going to impact what your day-to-day will look like. That's going to impact what kind of goals you're using, what kind of teaching, how much support you're giving. So you got to know the tier. The diagnosis is usually in there. There may not be a diagnosis, and so that might not be in there, and it is not required. And then you're going to want to look at, if it's mentioned, the learning exceptionality and impact on learning. We're going to talk about a bit more about this. This is going to help you best support your learner. So just quickly, the KHDA classifications, they have broken down the various types of disabilities and deficits, and so it'd be very helpful for you to know if your learner has a diagnosis, where does it fall? So the first type are cognition and learning, and within that we have intellectual disabilities, we have multiple disabilities, developmental delay, specific learning disabilities, which are typically dyslexia, dysgraphia, these type of learning disabilities. Communication and interaction. The communication disorders are language disorders, speech, sound, child onset fluency disorder, these different type of disorders. And then number 6, we have autism spectrum disorders, and then we have levels 1, 2, and 3. So if your learner has a diagnosis and they are specified as autism level 1, then it's recommended that you would go and have a look about what you can find out about that. Attention deficit, there's a few different kinds, and psycho-emotional are these types of examples. These are just examples. This is not a definitive list. Then we have physical, sensory, and medical, and we have sensory impairments such as hearing, visual. We have physical disabilities such as cerebral palsy or spina bifida, and then we have chronic conditions. Now, bear in mind that some learners may have multiple diagnoses, so they might be across different classifications. Okay, moving on to the next part is data points. So you may or may not see this data on your IEP. It may not be for younger learners, it may be for older learners, but data points will refer to scores from any standardized testing that the school has done, or it may have occurred in a psychological assessment. The school might do other placement tests, so they might do like a phonics placement test, a reading. Maybe an external agency might have done some tests. So for example, we at the learning community, we would do placement tests from DIBBLES, which is a reading program. We would do it from various different curricula that we have, placement tests. And so if the school wants that data for their IEP, we might provide that data, or they might just use their own. So these are just examples of the scoring from these different things. So let's look a little bit, because you may end up seeing this. So the CAT is the cognitive abilities test, and the MAP is the measures of academic progress. And typically schools might do one or the other of these, or they might do both. Now, these will help you as a learning support assistant to tailor your support for your learner. So the CAT looks into the student's cognitive profile. So verbal, nonverbal, quantitative, spatial reasoning. So this will help you understand how your learner processes information and in adapting your instruction methods. And the MAP results will show the student's academic achievement. So you can focus on areas that are weaker or stronger. So the importance of the results from the CAT and the MAP are you're going to use them to learn how they relate to the impacts on learning. So in other words, what are these telling you about your learner? What are their strengths? What are their deficits? What tools and accommodations can you use for them? How can they be leveraged to best support the learner in the classroom? I would recommend that you speak to the inclusion team about what they recommend based on these results. Ask what tools and resources they have for different types of learners. And let's look at an example so that this might be able to better help you. So our learner profile. Okay, their CAT scores, they have below average verbal reasoning. Now, in the context of the CAT, this would refer to how they are able to understand and use words. So kind of like logic and reasoning. Average quantitative reasoning. Now this measures a student's potential to reason with numbers, so not just their current math knowledge. It reflects how well a student can think logically about numerical information. Spatial skills, so this learner has above average spatial skills. So this is the ability to visualize, manipulate, understand relationships between objects in space. So, and then in the MAP scores, this learner has below grade reading, and the math is at grade level. So that's immediately going to give you an idea of what kind of goals you would be working on. Now, how would this actually translate into a support plan? Well, if this learner has above average spatial skills, then we can use visual aids like pictures and graphic organizers for vocabulary. They have below average verbal reasoning, which relates to, words, reading, and logic. So therefore we might want to pre-teach vocabulary before lessons because their vocabulary is on the weaker side. You might want to provide oral reading support to ease their verbal processing, and that could be because that might be you reading some of the text and then asking questions, and then breaking the text into manageable parts and checking comprehension frequently. Now this learner, remember, they have average quantitative reasoning, so kind of about normal for how they work with numbers, but they do have above average spatial skills. So again, use diagrams and manipulatives to leverage those spatial strengths, use those visual strategies for problem solving, and then because they do have average and above average quantitative and spatial skills, make sure that you're keeping their motivation high. So provide challenging tasks to make sure that they're not getting bored as well. The general strategies to help this learner would be to give clear, concise instructions with visual clues, allow extra processing time for verbal tasks, and to collaborate with teachers to adjust language-heavy tasks. Now, something that we should address is that LSAs, as mentioned before, they are expected to wear many hats. So in many ways you are teaching. If you are expected to modify, you are then expected to know the steps of the curriculum, all the different tool skills that are part of learning. You may be providing that self-care help, so you're taking on the role of a caregiver. You think here, as you're looking at these scores, that I'm now working as a psychologist because I'm interpreting these scores. And it's important to know that we don't expect LSAs to be able to be experts in all of these different areas. So on that note, something that is definitely already happening, and we know it is that people are using AI, such as they're using ChatGPT to help their learners. And we're going to just talk a little bit about the responsible use of AI, if you are allowed to use it. So you might want to check with your school if you're allowed to use it. So it's crucial to emphasize the responsible use of AI. This means integrating AI thoughtfully and ethically into our educational practice. So if you have older learners, I would recommend that you click on this link and read this article. It's by Ethan Mollick, and it's regarding how to use AI in class responsibly and honestly to use it in quite amazing ways. So it gives very detailed prompts and tips as to how to use it for your learners. I would recommend using AI to get ideas and strategies. Make sure that you are giving detailed prompts and problem solving. So, for example, you don't want to say math lesson plan for a 7-year-old with autism. This is not detailed enough. You want to take the results of the cat. You want to take the results of the map. You want to give as many details as you possibly can, and then ask for strategies and tips for a specific subject or a specific topic within the subject. So use it in a detailed way, use it for problem solving, read every single thing and check its accuracy. Use it when I say problem solving, I mean that you would talk back to it. So it might give you some strategies and you will say, well, I actually wasn't looking for this kind of strategy. I'm thinking more about this. So you engage in a conversation essentially with the chat or whichever one you're using, and you get a really, really detailed, helpful, ideally, plan or tips or strategies. I know that people do use it when they're writing reports, when they're doing communication, when they're using, I don't know, maybe people would be using it to write up an incident report. What I would recommend is to potentially use it to give you an outline and a guidance, but then change it so that you're using your own voice. It's extremely obvious when people send a completely AI generated report or incident or communication. You can tell straight away. So I would really recommend that you just use it for guidance and then you edit it to make it sound like you had written it. And definitely avoid blindly downloading and printing. I know that ChatGPT will ask if you want a lesson plan, and then they'll give you like a PDF lesson plan. There are frequently many, many grammar and spelling mistakes in these. Technology is evolving, but it's definitely not there yet. So absolutely avoid just pressing download, print, and giving it to your learner, because we do not want, this is not the standard that we would be expecting. So I would also say that if you use it to create resources or worksheets or get ideas, then show it to the class teacher and ask their advice. Say, do you think this is good? Is this something that we can use? And hopefully they'll be open to you using it for help, because it is amazing and it can give you a lot of help, but you got to use it carefully. So that's something to be aware of, and I did want to bring that up. Okay, let's talk about IEP goals. They're frequently organized into academic, social, emotional, functional, and sometimes there's a specific section for Arabic goals if your learner is taking Arabic. These might not all be featured on your IEP, but it might be. Examples of such goals, within the academic, we would typically have our reading, our writing, our math, language. Social, we'd be looking at interactions, play, peers. Emotional, confidence, self-awareness, advocacy. Functional, we'd be looking at routines, group, self-care, independence. And within the Arabic, again, there would be learning and language goals. Now, you might not be asked to write an IEP goal. The inclusion or SEND team might do this, but maybe you would be asked for suggestions, or some advice that I received from a director of inclusion is that they will be asking their LSAs to write goals as a way to evaluate their LSAs. And so this is something that you definitely want to be aware of. So IEP goals are ideally SMART goals. So they're specific, measurable, actionable, realistic and relevant, and time sensitive. And that's something to keep in mind. Now, for an assignment, you're going to write an IEP goal. So you'll have a chance to practice this, and we'll give you some feedback on that. it's a good idea to be familiar with how goals should be written so that you'd be better at implementing them. IEPs are going to come in all shapes and sizes, as I mentioned. These are just some examples. Your IEP might look like this. It might look nothing like this. This one up here in the corner, Foundational Math Concepts. This is a really nice detailed IEP. It's broken down into their present level of performance. How are they progress monitoring? This is really, really important. How are you proving that what you're doing is effective, and how are you achieving those IEP goals? And then they have them broken down into different sets. So that's a really, really nice example of a very detailed IEP. Also on your IEP, it may refer to services. We've talked about this already. Now, there are internal services, so that might mean extra tuition, inclusion pullouts. Maybe the inclusion teacher is going to come and take your learner 3 times a week. This should be mentioned on the IEP. And then in addition, your external provision should be on the IEP. So are they getting ABA in school? Are they getting OT? Are they getting speech therapy? That would be listed on the IEP. Something to note is that in some schools, instead of the IEP, it's called the Learner Passport. And this is a document about the student which includes many of the same things as an IEP. So their profile, their strengths and interests, the needs and challenges, all the different strategies and accommodations, communication tips. So how should you best communicate with the learner? And of course, their goals. So just be aware of that. If you end up getting a Learner Passport instead of an IEP, this is what this is, and it's a very, very similar document to an IEP. The IEP is going to talk about the accommodations and or the modifications that a learner will have. Now, there is a difference between the two. The other thing to note is that some schools call these adaptations, and they include both. But let's get into what accommodations are and what modifications are. Accommodations change how the student learns, and modifications change what the student learns. Within the accommodations, the curriculum level will be the same as the peers, but for modifications, it's going to be different to their peers. Within accommodations, we would expect that students would meet the same learning goal. However, in a modifications, the student has altered goals. Now we're going to do a lot of examples on this. So accommodations are about how the student interacts with the learning material without changing what they need to learn. So think of it as providing different pathways for students to show their knowledge while keeping the same high expectations as their peers. So these adjustments will enable the students to access the same content, but in a way that aligns with their needs. So this might include, within the instructional setting, so that's the classroom, they may get both written and oral instructions. They may have the use of the visuals, the manipulatives, which we've talked about, chunking information. Maybe they get small group instruction instead of all of their learning being in the main classroom with 25, 30 other peers, and maybe they get additional time. Now within the environmental, maybe they're in the front row of class, maybe that's on their IEP, should always be sitting in the front row of class. Maybe they're in a separate room, maybe they go and do their independent work in a separate room. There could be reduced visual or auditory distractions, maybe they wear headphones, for example, or different lighting options, or use of the headphones, as I mentioned. Now it's slightly different in terms of your instructional versus your assessment. So a learner may not have additional time in the instructional setting, but when it comes to the assessment, it's on their IEP that they get extra time. Maybe they have a scribe, so someone who writes their exam for them while they dictate. Or maybe they have headphones or a separate room, or someone reads the questions or clarifies the directions, or they get a spelling assistant. So on the assessments, this is really, really important. LSAs, you can remind the learner to take their time, and you can advise them to read all the parts. That's pretty much all you can do, unless it is specifically in the IEP that you read the questions to the learner, as we mentioned, these kind of, what are these accommodations that are in assessments? They might get structured breaks, a different environment, extra time, or you can chunk the information for them, or they use a device. The LSA cannot, okay, really, really, really important. You might be, as an LSA, sitting beside your learner as they take their CAT, as they take their MAP, as they do another assessment. You cannot change the assessment material. You cannot define words for the learner. So if the learner reads the question and then turns to you and says, what does strategy mean? But I don't know what it means. You cannot define the word. If you're watching your learner and they pick the wrong answer, you cannot say, are you sure? You cannot say, try that one again, check that one. You cannot, or for example, the learner says, is this the right answer? Do you think it's 4? And you say, are you sure? That's a leading question. You cannot affirm the choice of answer. So for example, the learner picks, B, and you go, yeah. Maybe your learner will look to you, or maybe they won't. You cannot give a thumbs up or say yeah or good job. You cannot help to choose the answers, so doing some problem solving with them. So you can't say, okay, let's think about this. If there are 4 triangles and we need to add 2 triangles more, then what do we do when we want to get 4 plus 2? Well, what should we do? You can't do that. You cannot give any sort of problem solving or helping them choose the answers. You can't allow them to finish the test another time. So maybe it's, an English test and they get the paper and they do half of it and you say, do you know what, you can finish it after break. You can't do that. Or offer incentives to finish. So kind of jolly them along. Let's say they're doing the assessment and you go, come on, after this, we're going to go out to play in the playground and I'm going to give you your lunch and you can get your iPad. You cannot use this. Any of these things are you providing prompts and help to the learner, which will result in an inaccurate assessment, which will then lead to them having an inaccurate IEP or wrong support strategies or an unrealistic picture of what they're able to do, which, yes, okay, maybe they get a better score and everyone's happier, but in the long run, this is not going to help your learner. It really, really won't. We need to have a realistic picture of the learner. So if in doubt, if they asked you something and you just weren't sure what to do, write the question down. You could always go and check with the teacher, can I help him with this? The answer is probably no. And just making sure that all of those adaptions must be agreed with the SEND team beforehand. For example, if they're getting extra time, that needs to be agreed beforehand and it should be on the IEP. So that's some really, really important information to bear in mind. Okay, let's go on to the modifications, which are as follows. So modifications refer to changes in what a student is taught or what is expected of them. So they can involve changes in the curriculum itself. So we might simplify material or focus on essential concepts. And this will typically change the educational outcome. So many of you will be working with learners who have a modified curriculum. And that's typically because any assessment results that have been done or any language assessments or diagnoses or psychological reports will indicate that their skills are currently behind in terms of maybe the grade level. So maybe your learner is in grade 2 or year 3, but their language is operating at a KG2 or an FS2, or their academic skills are at that level. And that's typically why the curriculum is modified, because the curriculum that their same age peers is doing is too advanced at that time. And typically the learner will still be in the same age peer group, for social reasons, and they will be with their same age peers, but the type of work that they're doing is going to be different. So here's some examples of modifications. So yeah, the simplified curriculum, reduced assignments. So maybe it's the same math, maybe it's addition, but the rest of the class will do 20 and your learner will do 5 because it's still a skill that they're working on. They might have a lower reading level, alternate assessments, modified grading criteria. So maybe the teacher will give them a grade focusing on effort. So, they might get a B or an A even if they don't do the full assignment because they have shown some really good work for their ability. Alternate learning goals. Yeah, so they might be focusing on functional life skills. There will be a lot of learners that you're working with, particularly in the British system, who might be enrolled in an ASDAN course. You might be familiar with ASDAN. And so they might be working on those functional life skills or functional academic skills. So they might still be academic, but they might be functional. For example, writing their name, writing a shopping list, using money, being able to use the washing machine, the numbers on the washing machine, the numbers on a phone. These are all academically aligned, but they're more functional. So your learners might be doing those kind of goals. And they might just get more time, extended time for mastery, and different course expectations. So what is the role of the LSA when it comes to the IEP? So once you get your IEP goals, you're going to want to discuss them with the class teacher. So you're going to want to talk about the goals and how you're going to achieve them. Absolutely crucially, you identify if your learner is receiving a modified curriculum. This is something you have to know. You'll then break down each goal into manageable steps if it's needed. You could do this with the help of the teacher, with the help of the inclusion team, with the help of external agents. This is what we at the learning community spend a lot of our time doing, is helping the LSAs break the goals down. Then you're going to implement the interventions or teaching strategies which are recommended in the IEP. So what they recommend you do. It's your job as the LSA to ensure that the modifications and accommodations are always in place. So if your learner is supposed to get extra time on an assessment and that doesn't happen, then you got to speak up for them. You know that it's on the IEP, or you know that this was recommended, and a teacher goes to finish your learner, you got to speak up. You got to say, oh, hey, he's got extra time. And then really, really, really importantly, you have to identify how progress is going to be tracked. You have to show how you are progressing in your IEP goals. If the school doesn't provide an IEP tracker, a progress tracker, then you're going to want to make your own. Get in contact with an external provider so they could help you. This is something that we do a lot with our learners. And just make sure that you have some way to show how the IEP is progressing. Okay, so that's it for this section. You will see your assignments and your quizzes, and then you'll move on to the next section. Thank you.